teams, Lauren here with Bizrok. In this week's video, I want to talk to you about controlling the conversation. Look, if you've gone through our case acceptance training and our communication and language training, we've talked through ways to control conversations. And today's video is about putting all of those different tools all together in one snapshot video, okay? So controlling the conversation starts with how we ask questions. Are we asking questions of the patient? Even if they ask us a question, we can answer it and then ask them a question. That creates the opportunity for us to guide our patient anywhere we want. For example, if a patient says, I need to schedule an appointment with you. That's a statement, right? You might say, thank you so much for reaching out. Would you prefer morning or afternoons? See, now I've asked them a question. Now I have control of the conversation. And as crazy as it sounds, by asking a question, I'm saying, all right, I'm done speaking and now it's your turn to speak, right? So when the patient says something like, it doesn't matter, it just depends on the day. Then you can still ask them a question. Okay, well, the first two that I have available is this day at this time or this day at this time. Guys, the same is true whenever you're presenting treatment options to your patient. So you might say, Susie patient, are you looking for a long-term result or a short-term fix? Now I have control of the conversation because I just need to start broad and kind of work my way down. I'm trying to figure out what type of treatment plan is best for that patient. And the more questions I ask them, the more, one, I'm controlling the conversation, but two, getting to my ultimate result, which is trying to figure out why they came into the office today and what's most important for them. Now, later in some of our other videos, we talk about specific questions that you should be asking your patients to really get systematic with exactly the type of treatment plan that they are looking for. But guys, when it comes to controlling the conversation, this is where you start mastering questions, becoming a master question asker, okay? Now, the other thing that I would say when it comes to controlling the conversation is if you've gone through any of our training before, guys, you should have mastered different communication tools like the HERD method, feel, felt, found, understanding principles of influence, the 3-part formula, which is gratification, education, ease of business. All of those different formulas allow you to take control of the conversation and again, guide your patient where you want. So what you don't realize whenever our team is teaching and training and we're working with you guys, whenever you're asking us questions, we are answering them, but we're answering them and plugging those answers into a formula, okay? You can do that same thing with your patients to, again, control and guide them where you need to go. Does that make sense? So, for example, the patient comes in and says, look, doc, I'm just here, I've got a little bit of pain in the upper left, and I just want to get that taken care of for today. Like, great, they're telling you what they want, but it gives you a starting point. So one, you should solve that issue. Now you can also say, all right, Susie patient, let's talk about that treatment, but I do see there might be some other things going on. Is it okay if we talk through your full mouth? Because I am concerned about your full mouth oral health. Now I've asked them a question and they can either give me permission or say, I don't have time to do that today. And you can say, hey, that's okay. Next time you come in, we'll talk about some additional treatment potentially that might be needed just next time you're in, okay? So it's still giving you control and it's still guiding your patient to the best possible solution. But again, they're telling you, I just want to focus on this upper left for today. Does that make sense? All right. So if the patient does open up the door and say, yeah, I've got some time, like we can talk through some additional treatment. Now I have the opportunity to move forward with them. And so I might also say, thinking back to my 3-part formula, gratification, education, ease of business, Susie patient, thank you so much for that opportunity. Now I can ask them questions, right? What's most important to you? What do you value most with a dental relationship? What's most important for you as far as longevity or cosmetic or comfort and function and how something looks? So I can educate them on potential solutions, and ease of business is actually presenting those 2 solutions at the very end. See, everything that we teach you guys, if you plug it into those formulas, it allows you to control the conversation and guide the patient forward, because at the end of the day, that's our goal, is just to move the patient forward to the best possible solution for them that's achieving their goals, and we just happen to be the guide to get them there. So guys, practice this in your office, role play it, fall back on all of your tools, whether it's HERD, feel, felt, found, 3-part formula, principles of influence, dual close, and make sure that you're asking questions. And as always, guys, if you need help, if you need support, reach out to us. Our team would love to help and support you. Otherwise, guys, we can't wait to see you and serve you soon.